And here are the latest statistics confirmed on the coronavirus as of last night. New daily cases in the United States, 36,447, with 1,197 new deaths. Total cases in the U.S., 6.7 million, more than 200,000 deaths, and more than 4 million who've now recovered. Total cases worldwide, 29.7 million, with more than 939,000 deaths and more than 21.5 million people who have beaten the virus globally. As we're on this subject, let's just go ahead and continue it with Dr. Kavanagh. He is a retired physician and founder of Health Watch USA. Dr. K, good morning, sir.
Good morning, Jack.
How are you today?
Pretty good. Up bright and early.
Yeah.
Well, at least early.
Yeah, well, early anyway. I don't know about the bright part. Vaccine, 2 doses will take 4 years. Tell us that story.
Well, this is a warning that came out from the largest manufacturing company in the world of vaccines, and this is based in India, called Serum Institute, and it said to vaccinate everybody in the world, it would take 4 years. And this got a lot of press, but what didn't get a lot of press is that there's 160 other companies that are also making vaccines, and that in the United States, we're in a much, much better position. So I think we'll have our population vaccinated much sooner. What is of concern that I thought is the 2 doses. Almost all vaccines that I know of, in fact, all of them, require 2 doses. And that really indicates that this virus doesn't cause a huge immune response. Of course, it's a coronavirus. We've talked about that before. But that's also going to place a strain on the system because now you have to manufacture twice as many vaccines. And if you think about it, we also discussed that, well, maybe this vaccine will only last 1 to 2 years, so you may need another dose, similar to the flu vaccine.
Right.
And so if it takes 4 years to vaccinate the world and the vaccine only lasts 1 to 2 years, that's not a good plan. I think the world needs to have a better plan than what we have here in the United States. I really do like the way we're situated in the United States for manufacturing. As you know, everybody's discussed the findings and the conversations regarding hurrying up, making the vaccine too soon, and taking steps that have shortcut the process. But I do think at present there's enough safeguards, and we've got good reassurances from the FDA that this vaccine is going to have oversight. And it is, believe me, Jack, it is a vaccine for a very dangerous virus. So if you have a bad outcome that occurs in 1 chance in 5,000, that vaccine might not have normally gotten approved. But when you're up against a virus, when someone in my age group, if I get that virus, would have 5 chances out of 100 of not recovering, that vaccine looks pretty good to me. So please go on ahead and let's follow the science. And if the science says this vaccine is effective and it's safe, let's go on ahead and get it.
Tell me about the University of Kentucky and the University of Louisville testing sewage. What's that about?
Well, I think that's really interesting. And we've talked about pool testing before, and that's where you get a number of samples from different people and pull them into a single sample, test that, and if it's clear, then all the samples are clear. It only requires 1 test. If it's not clear, then you can go on and test everybody. So what they're doing now is testing sewage, and this really has 2 applications. For universities, they can test sewage from dorms or office buildings and either clear or have suspect that someone in that building or dorm has a virus. And if they are suspicious, then you do case tracking, test everybody in that dorm or in that section of the university. On a community level, it's very good for seeing how the community is working. It doesn't require on people going and getting tests. Everybody uses the toilet, you have sewage, and lo and behold, you can determine how the community is doing as far as controlling the virus without all these other biases of, are they getting tests, do we have enough tests, etc. And this allows for good decisions in the community on when to open certain venues. So sewage testing, although it doesn't sound really innovative, believe me, that is an innovative place to be right now, is in sewage. Never thought I would have said that a few years ago, but that's bright and promising.
Yeah, when you start complaining about your job today, think about that. The UK has tested positive for the virus from how many students?
Well, over 1,300 students, and this is disturbing. They have, however, done, from what I can see, everything right from the administrative side of things. I am worried about the students on their behavior because it's really all dependent upon students. You can have all the safeguards in the world put up in place, but unless the students are compliant and unless they're following public health advice, it won't work, and it will result in the university closing down. I think UK is doing it correctly. They have ample space to quarantine students. And of course, if a university does have to close down in-person classes, you don't want to send those students back to the communities or homes, or you just become a super spreader event that spread the virus all over the state. And I think UK is well aware of that. But of really a positive note is that there have been studies done and observations of some of the sororities around the nation, at least one, and this was out of Texas, about 80 people in the house. They were able to really hold down their rates of infection by following very strict social distancing, strict guidelines of not partying, not going out. They weren't congregating together in central areas in the house. They were ordering food from the outside, and they were really able to drive the rates down. But unless the students of the university start following that advice, they will just acquire and spread the virus similar to any other venue. I mean, you want the university to be like a library right now, not like a party and a bar. And so that's what the students need to do. And I feel that that's extremely important.
Dr. Kevin Kavanagh, thank you very much.
Thank you, sir.